Hello, my name is Paul Edwards. I'm the president of Thayer County Health Services. I want to thank you for your efforts over the past several months as we've dealt with the COVID-19 virus and pandemic here in our state and throughout the world. We know that following the CDC guidelines of wearing a mask, good hand hygiene, and maintaining social distance are all ways to prevent the spread of the virus. If you're feeling under the weather, say you have a sore throat, a fever, a cough, runny nose, it's better to stay at home versus spread what you have to others. Thank you so much for promoting public health here in Thayer County and throughout the state.
Hi, I'm Leanne Hendricks, a family medicine physician at Thayer County Health Services.
Hi, I'm Travis Wright, PAC.
We are here today to inform all of you about some important things going on in our community related to COVID-19. As cases continue to rise in our county and district, the staff at TCHS are asking all of you to please follow the necessary precautions when it comes to COVID-19. We recognize that there are many questions and each situation is evaluated on a case-by-case basis, but we wanted to share some general information that may answer some of your questions. What are the COVID-19 testing protocols and processes at Thayer County Health Services? COVID-19 test results are most accurate when testing 3 to 5 days from the onset of symptoms. Testing an individual too soon can result in a false negative. TCHS in-house testing, a rapid test, is only a valid testing method for symptomatic patients, again 3 to 5 days of symptoms. If your test isn't a rapid test, it gets sent out to another lab that can take 2 to 3 days to get the results back. TCHS is not testing asymptomatic individuals, aside from pre-ops. If you are asymptomatic and wish to undergo a COVID-19 test, we recommend utilizing a Test Nebraska site. Due to limited testing supplies, our rapid tests are used at the discretion of the provider, who will then determine the need for a rapid test based on the severity of symptoms. Due to limited supplies, we are unable to provide a COVID-19 test to every household member. Most often, the sickest family member will be tested. If other household members are also sick, assume you are positive due to having a direct exposure to a positive symptomatic individual. If individual household members wish to get tested, please utilize Test Nebraska sites. To be clear, TCHS is not turning away people who need medical treatment or who are wanting to be seen. We are simply trying to preserve our limited supplies as best we can.
What are the quarantine protocols when should you quarantine? Symptomatic individuals should assume they are positive and quarantine until they are able to test and receive their test results. Household members must quarantine as well. No work, no school, no running errands until results are received. If in quarantine, ask others to run errands / grocery shop for you. Several businesses in the community will deliver safely to you. If your COVID-19 test is positive, you must quarantine for 10 days from the onset of your symptoms. After those 10 days are complete, and as long as you have been fever-free for 24 hours without medication and are seeing improvements in your other symptoms, you can stop quarantining. Try to isolate positive individuals from other household members. You must quarantine for a minimum of 10 days from the onset of symptoms because you can be contagious and spread the virus to others through 10 plus days. Quarantine if you have close contact to a positive case within 6 feet for 15 minutes without a mask for 14 days from the last close contact you had with the positive individual. You can develop symptoms even on the 14th day of quarantine, so be very vigilant about your symptoms and take your quarantine seriously. If you are diagnosed as positive COVID-19, isolate and separate yourself from people who are not sick to avoid spreading the illness. If you have close contact with a COVID-19 positive case while they are infectious, quarantine to limit community exposure and monitor your symptoms. If you have close contact with someone else who has had close contact with a COVID-19 positive case, practice preventive actions such as washing your hands, wearing a mask, and being alert of your symptoms.
What is the current facility capacity and how does it affect the care TCHS provides? We continue to provide the same quality health care to all of our patients. As cases across the area rise, we continue to reassess the situation and will notify the community if any impact it may have on our patients. We are very cognizant about our staff being stretched thin. We have implemented cross-training and are all working to share the extra workload that COVID-19 brings. We, along with other facilities in our district, are concerned about the healthcare resources of our hospital and other hospitals in the state over the upcoming weeks. As our referral facilities reach or surpass staffed bed capacity, it will become increasingly difficult to transfer patients to a higher level of care despite the diagnosis. Facilities have a limited supply of beds, staff, and other resources. If COVID hospitalizations do not decrease soon, healthcare providers across the state may be faced with extremely difficult decisions regarding who receives medical care. There are a variety of things you, our community, can do to help. Wear a mask, wash your hands frequently, maintain 6 feet of social distance, and avoid the 3 C's: crowded places, close contacts, and confined spaces. These measures are extremely important and can help reduce the spike of positive cases in our area. All patients with COVID-19 symptoms are asked to call ahead and schedule an appointment prior to arriving at the facility. Suspected COVID-19 patients will continue to be directed to the emergency room entrance at the hospital in Hebron. Please be responsible this holiday season. The last thing anyone wants is a loved one in the hospital. The best way to prevent that is by practicing COVID-19 precaution measures to stay safe from this deadly virus. As a facility full of your family and friends, we ask you to please help us slow the spread in our community and Nebraska as a whole. If we all do our part, we can have a direct impact. Remember, we are in this together.